I want to welcome you to today's webinar. And when I realized that I was given welcome, I was like, no, that's someone else's responsibility to do that, because I feel so deeply honored to be here on this beautiful campus and to be with you at the Morehouse School of Medicine. I want to provide some context for today's time together, and that this is the third stop in what has been an amazing journey across the U.S. to visit campuses, historically Black colleges and universities, to visit our campuses, to meet with institutional champions and others who are associated with the All of Us project. As the Executive Director of Community Campus Partnerships for Health, it's been our pleasure as an organization to partner with the National Institutes of Health and the All of Us project. You'll hear more about All of Us, the institutional champions, and the amazing work that's occurring here at Morehouse School of Medicine from a number of faculty, staff that will be presenting today. And so again, we're glad to have you. For those of you who are joining us virtually, welcome. For those of you who are here in person, we're excited to see you. We're glad to be here. Thank you for your hospitality. I want to do one more acknowledgement. Oftentimes we reserve or hold the thank yous to last, but I want to start today with a couple of thank yous. First of all, I want to say again, thank you to Dr. Pimu, to the faculty, staff, administration, and students at Morehouse School of Medicine for opening up your campus to allow us to be here today. Thank you very much for your hospitality. Thank you for your support. Thank you also to the support team, IT, and others who have made this possible. We are pulling together a partnership between Community Campus Partnerships for Health. On the back end, the group that you don't see is the production team at Howard University. I want to acknowledge the WHUT television station at Howard, who has been with us at each stop in the journey. And when I thought about that yesterday, that's really unique and historic in some ways. I don't think that we've seen this level of partnerships between the production teams and local groups as well. So this is really so very unique. So I want to acknowledge that piece in terms of the cooperation and the support between Howard University and our second stop, Tuskegee, University, and now Morehouse School of Medicine. I also want to say thank you and acknowledge the support and leadership of our team, the Community Campus Partnerships for Health team, and that includes Virginia Hunter and Sarita Hannah Boykin as well. It's also good to see other CCPH team members in the audience. So again, welcome. Thank you for joining us. Thank you for being here. I'd like to turn it over to Dr. Pimu, who will lead us now. Dr. Priscilla Pimu, thank you.
Thank you. Apologies for that extra background noise. It's not a Zoom thing until you have a Zoom mishap, right? But thank you so much to everyone for coming here today. I want to welcome you formally to Morehouse School of Medicine. We're really glad to see everyone who made it in person. And for those of you who are online, welcome. We're having all kinds of really great stuff that you don't know about. So this to us is a very important opportunity. It's a very important engagement, and I'll tell you why. Our journey, so first of all, Morehouse School of Medicine, for those of you who do not know, is a historically Black medical school whose mission is to lead in the creation and advancement of health equity and justice. And so in line with that mission, every action, every project that we take on is focused on doing this. We work based on those values. And when we were approached to participate in the All of Us research program in 2016 or 2017, this was what was on our minds, that it was an important effort, that it mattered that we were able to engage members of our community, that what we do find will be important in leading in that creation and advancement of health equity. And so we joined with our full chest, as they say, very eager. And I'm proud to share with you all that in that time of our engagement, Morehouse School of Medicine has seen almost 7,000 participants. Of that number, close to 4,600 are considered core participants in the program. And even more important is that of that number, the proportion that are African American or Black is about 96 or 97%. So that is pretty significant for us. And I'll tell you, a few of our frontline people are here. The rest of them are at the front line doing the work of engaging our community. But one of the things that strikes me every time we talk with the community or talk with participants is that their eyes light up at the idea that cures will be developed with their own particular characteristics in mind. What we do know at Morehouse is that when you have people who know enough, care enough to ask the right questions, you're going to get to the answers that are relevant to the community. And so it's been very important for us that not only do we contribute to the data set, but that our learners and our researchers are capable of using that data to ask and answer questions that are relevant to our community. And so that's why I'm so excited about this opportunity to talk about the Researcher Workbench with our researchers, with our trainees, get that information out there. I look forward to the presentations that you're going to hear today. We're not only an enrollment site, and I was informed that I had to share with you all that we are at the site where we do a lot of the enrollments for all of us. So Morehouse is engaged in the program as a health provider organization. One of our researchers that you're going to hear from today was actually one of those that pioneered the use of the Researcher Workbench. Dr. Robert Miller is going to be presenting later in the day and sharing what that experience was like. And another one of our researchers, Dr. Mohammed Idris, is also going to be speaking today. He got an award to be a champion to engage researchers within our community in using this Researcher Workbench. And so my hope is at the end of all this, we have the beginnings of what is known in public health as a community of practice. People that are engaged in doing this, we know that in our culture, we're a communal culture. When you're many of you together working toward the same goal, you tend to go further. And that's what we're hoping for. So welcome. Welcome to Morehouse School of Medicine. Welcome to the Clinical Research Center. Thank you to my colleagues and all of us who work together here who showed up this morning. I really appreciate your presence. Just get ready. There's a lot of excitement about to happen. I sound like Bishop Jakes down there. Welcome.
Thank you, Dr. Pimu. So yes, as you mentioned, we're doing some adjustments because you've never met me, I'm 6'6", and so there's a lot of adjustments that I've had to make in life. And so we're making a lot of adjustments today. So thank you, Dr. Pimu. Yes, get ready, get ready, get ready. Yes, I found out there are a lot of ministers and church folk here at Morehouse School of Medicine. And so thank you for that, setting that up so beautifully. Yes, it is unique in that we have been at 2 other sites, but this is the first site where we've actually been right in the midst of recruitment and engagement taking place. Yesterday, as I was wandering down the hall, I saw all the signage for all of us and the banner, and all of that was extremely exciting. At this time, it's my distinct pleasure to introduce you to Dr. Kareem Watson, who's the Chief Engagement Officer for all of us with the National Institutes of Health. But not only that, but Dr. Watson is a friend and colleague of Community Campus Partnerships for Health. Dr. Watson, we're glad to have you. Thank you for joining us today from DC, Chicago, or on the road. Thank you.
Thank you so much. Can you hear me okay, Al and others?
Yes.
Great. Good morning, everyone. It's such an exciting pleasure to be here. And as Al, Mr. Richmond noted in his introduction, it's truly a humbling experience to be here. And Dr. Pimo opened up the door talking about Bishop Jakes this morning. Get ready, get ready. One of my favorite sermons from Bishop Jakes is From Prep to Promise. And what that sermon always reminds me of is the importance of the preparation that you must do in order to fulfill that promise. And when I think about the promise of precision medicine and what we have promised the community that we would do is that we would do business differently this time around. We would think about including and engaging those populations who have been historically under-engaged in research. As a cancer disparities researcher who spent 17 years at the University of Illinois, Chicago, which is a minority-serving institution, working primarily with minoritized men, one term that I used to hate to often hear was hard to reach populations. Whenever someone would tell me that a population was hard to reach, I would refocus them and readdress that conversation and say, I think the populations are under engaged, because as an African-American male, I've never had difficulty engaging and or reaching other African-American men. It's about intentionality and providing the appropriate resources. And as TD Jakes would say, it's about the preparation that needs to take place before you, so that you can move into that promise of what you will do to fulfill that mission. And when I think about the purpose of us being here today, I am so excited because this was a promise that we did fulfill. When I took the role as Chief Engagement Officer for the All of Us Research Program, I was very unapologetic and very vocal about our commitment to engaging HBCUs in this work. In addition to the work that we do to ensure that participants are engaged in research who have been historically underengaged, it's also vitally important that we often say that the messenger matters. And there's research that shows that when there's cultural congruency between the research team and the community at their engagement, you already begin to establish levels of trust. You already begin to have levels of familiarity, cultural understanding. And I won't say that trust is built already, but you establish that, at least that communal nature that Dr. Pimo talked about. And if you've never seen Morehouse's team in action, I would encourage you to go see them in action. I've been privy to watch some of their things on LinkedIn and other places where they are in the community, doing the work, engaging their frontline staff is next to none. And I am so proud to be a part of that team. For them to be a part of our team. See, I'm trying to make myself a part of the team already, but I will not hold you all up from today. But again, I want to thank our partners at CCPH, Community Campus Partnership for Health, as well as our amazing partners from RTI. RTI has been an amazing partner, you all, for the All of Us Research Program. RTI is one of our national community engagement partners. And whenever I call on RTI with a new idea and I say, hey, we want to do this engagement better, they are always there to say, Kareem, how can we roll up our sleeves and do the work and be a partner to continue to champion this work? So I thank you all. Thank you all for the work that you're going to be doing on the workbench to advance this work. Please continue to reach out to our team to let us know how we can do this work even better and to be more responsive to the needs of the communities and the partners that we serve. And again, I just want to thank you all. And I'm excited about how we will continue to move from preparation to promise, because we're doing the work and we have the right people at the table to do the work. Thank you all.
Hello, everyone. My name is Dr. Sula Hood, and I'm a senior research scientist at RTI International, and I also serve as a co-lead for the All of Us Researcher Academy. I am based here in Atlanta, Georgia. I am born and raised, and so I've known about the AUC and Morehouse and the School of Medicine my entire life, but this is actually my first time on the campus, and so I am just so happy to be here with you all today, and also to just be here in this capacity. So I'm just going to share a little bit about the All of Us Researcher Academy that we lead at RTI, and really encourage you to kind of take in all of the different components of the academy, and think about the ways in which you or your colleagues or your students might be able to get involved. So just a little bit of background about the Researcher Academy. It is in support of the All of Us research program, which, as many of us know, is a historic effort to study and collect data from 1 million or more people living in the U.S. And there is intentionality about engaging diverse populations so that we can really advance and speed up medical discoveries in the area of precision medicine. The All of Us Researcher Academy in particular provides training and technical assistance to researchers that are working with the Researcher Workbench, which is the cloud-based platform that houses the All of Us data. And so the first phase of our Researcher Academy is directly focused on supporting researchers at historically Black colleges and universities. Next slide, please. Okay, so as I mentioned, just a goal of the Researcher Academy is to really establish a diverse learning network of researchers who use All of Us data. And when we say researchers, we mean students, we mean postdocs, we mean faculty members and other researchers. And we're really focused on supporting and promoting equitable access to and utilization of the All of Us Researcher Workbench by a diverse array of researchers from all different backgrounds, including demographically as well as institutionally. Next slide, please. Okay, so now I'm just going to walk through a few of the offerings that we have through the Researcher Academy. One feature that we have that I'm really excited about and proud of is our availability of tuition-free short courses for our Researcher Academy scholars. And so we have courses on a wide range of topics that relate to accessing the Researcher Workbench, how to design research studies, how to analyze and manage data. We also have courses on research dissemination, things related to grant funding, development. And we also are very intentional about supporting educators to bring exposure to the Researcher Workbench to their students as well. Additionally, one of our newer course offerings is focused on engaging librarians at institutions and helping them to work to connect their faculty members and students to the All of Us data set. One thing I was also going to just mention about these courses that we've been very intentional about is that the instructors of these courses are all around the country and even to an extent around the world. We do have some people that are international, but we've been intentional about engaging instructors that either are HBCU alum or have some sort of affiliation so that they truly understand the institutional context of the researchers that they're engaging. Next slide, please. Okay. And then our next offering that we have is the Institutional Champion Award. And Dr. Pimu mentioned that Morehouse is one of our more recent recipients of this award. But the Institutional Champion Award is designed to support teams of researchers at HBCUs to work on projects using the All of Us data set. And so teams of researchers are comprised of faculty members, postdocs, and students, and these are for 1 year, and they're up to $75,000. And we really promote interdisciplinary collaborations. And so our teams are made up of researchers from a variety of different types of departments and disciplines. So our first round of our first cohort, we had 6 institutions, and you can see them over on the lower left of the graphic. And then we recently awarded a second round of awardees here in July, which Morehouse School of Medicine is one of our new awardees. We are now scaling up also to include Hispanic-Serving Institutions for institutional champion awardees. And so we currently have an RFA open, which closes by September 8th. And so I'd be happy to share more information about that with you and encourage you to please share it with your colleagues at Hispanic-Serving Institutions. Next slide, please. Okay, so in addition to really supporting faculty members and postdocs, we're very intentional also about supporting students and exposing them to the Researcher Workbench. And so we have a Researcher Academy internship, and this is really to facilitate experiential learning through mentored research projects. And so students are actually paired with researchers that have active projects in the Researcher Workbench. And they're hosted either virtually or in person, 3 months in length, and they are funded for the students as well as the mentors as well. We recently had our first cohort of interns conclude here recently, and they were 6 interns from Howard University. And so we're looking forward to hosting our next cohort in summer 2024. Next slide. Okay, and finally, one additional aspect of our Researcher Academy I want to highlight is our Researcher Academy newsletter. It is called Connections, and it comes out quarterly, and it has a lot of great information in it. We have a researcher spotlight where researchers around the country that are a part of the Institutional Champion Award cohort or the interns or others, we spotlight them to share about their great accomplishments. We also have a career corner where we provide career tips for people who are either transitioning careers or for students that are newly coming into their careers. We have an announcement section for all of the opportunities that come through the Researcher Academy, as well as some of our other partners that want to share information in our newsletter. And then finally, we also share about upcoming courses and events. And so the summer issue has recently been released, and we have a QR code here on our screen, and definitely encourage you to sign up and join our subscriber list. So thank you so much for just hearing a little bit about the Researcher Academy. I will be around and would be happy to answer any questions that you may have. Thank you.
Thank you, Dr. Hood. I want to just take a point of personal privilege to say a little bit about Dr. Hood. In terms of Dr. Pimu was describing the types of engagement activities in a broader sense in terms of what's occurring here in Atlanta in the region. And I recall that one of the first opportunities that I really had to connect with Dr. Hood was as a postdoc at the University of North Carolina at Chapel Hill. And she was doing a research project on in the African-American community. In particular, she was using family reunions as an opportunity to engage with communities. And I said, well, I have a family reunion and we have lots of African Americans at our family reunion. And she said, great. And so we partnered together. And I highlight that as being what Dr. Watson described as this culturally congruent context in which we really seek to grow, is that we're moving away from thinking about our community as being underrepresented to being underengaged. And the whole idea of using a family reunion as a strategy to effectively reach African-American communities or other communities can be just really amazing and novel in many circles. We had about 75 people present. And so we had a captive audience of individuals who were willing to at least hear the message and then enroll and participate in a project because I was involved in it. And by proxy, there was trust that was established, and they were willing to listen to Dr. Hood. So I wanted to just acknowledge, Dr. Hood, that you are in fact a community engaged researcher and scientist. I want to now introduce you to Dr. Kathy Shearer, who is joining us from Vanderbilt University Medical Center. Welcome, Kathy. And we'll have other team members from Vanderbilt who will be joining us a little bit later on for our Q&A. Take it away, Kathy.
Great. Thank you so much, Mr. Hammond. So like Mr. Hammond mentioned, I'm a postdoctoral research fellow at the Department of Biomedical Informatics at Vanderbilt. I'm also a member of the Data and Research Center, or the DRC, which houses the database of information that is provided by the All of Us participants. So the goal of the center is to provide the resources and tools to support researchers. And today, for the next 15 minutes or so, I'm really excited to share and introduce you to the All of Us Researcher Workbench, which is the tool that you will need to fully harness the power of the All of Us research dataset. Next slide, please. So before diving into the details, I would like to orient everyone to our data release timeline. So in 2019, the program released the data browser. So this is our interactive, publicly available tool that provides summary statistics about the program's data set. And in the following year, the program released the Researcher Workbench. This is our cloud computing platform that allows researchers to analyze participant level data. And this will be the focus of my talk today. In the next couple of years, we continue to expand our data set and tools. And in 2022, we launched the control tier, as well as our first release of the genomics data set on nearly 100,000 whole genome sequences. And in 2023 and beyond, the program continues to provide additional data types and tools. So one thing I really want to emphasize is that the All of Us research data set and the tools like the Researcher Workbench are constantly expanding and evolving so that researchers have exactly what they need to make important discoveries about diverse populations. Next slide, please. Great. So here's really a 30,000 feet snapshot of the data that are currently available in the Researcher Workbench. And there are 5 main data types that can be broadly categorized into phenotypic data and genomic data. So within the phenotypic data, we currently have surveys, physical measurements, electronic health records, and Fitbit records. And for the genomics data, we have nearly 250,000 whole genome sequences, along with genotyping arrays, structural variants, and long read sequences. Next slide, please. So for the next few minutes, I really want to shine the spotlight on a couple of different data that we currently have in the Researcher Workbench that I think are critical for advancing community health and health equity research. So the first data that I would like to highlight is the Social Determinants of Health survey. So this survey collects information from participants about their social and environmental factors. Sorry, could you go back to previous slide? And currently we have over 100,000 responses, which will provide researchers the information that is critical to understanding how different social determinants of health can impact an individual's personal health, depending on their social and living factors. Next slide, please. The second data that I want to highlight are 2 new mental health surveys that were released this July. And these are surveys that cover a wide range of topics on how mental health and well-being impact individuals' overall health. And we really hope that with researchers with this type of data can really make breakthroughs about how mental health and well-being affect precision health in their communities. Next slide, please. And last but not least, I really want to touch on the expanded genomics data set that was released this April. And this is nearly 250,000 whole genome sequences that were made available to the researchers this April. And this is the world's largest and most diverse genomics data set of its kind. And what's great about the genomics data is that it's linked to all of the phenotypic data that I mentioned earlier. And so with that data linkage, it can really enable some powerful scientific discoveries. Next slide, please. All right, so that was a really quick overview of the types of data that we have on the Researcher Workbench. And so with the richness and the diversity of the data set, as well as tools like the Researcher Workbench, all of us can support a wide range of different studies. So here we've got a tasting platter, but this is definitely not an exhaustive list, right? So here we have some example studies which can range from exploring associations between diseases, medications, behaviors, social determinants of health, genomics, to exploring health disparities in historically underrepresented populations, to exploring drug target discovery, and so on and so forth. And with tools like the All of Us Researcher Workbench, our program can support a wide modality of research. And these can range from basic EHR investigations to more advanced AI/machine learning algorithms development. Next slide, please. And so what we're really excited about is that we've been seeing a lot of papers on community health that have been recently published using the All of Us data set. And so here I've got a little collage of screenshots of some of these publications, and these really vary in a wide range of focal areas. And they can be exploring hypertension prevalence in diverse populations to examining racial, ethnic differences in healthcare barriers. And this is really only the beginning, and we really look forward to future research projects that really advance community health and health equity research. Next slide, please. All right, so now I want to switch gears a little bit and talk to you a little bit more about how the data and the resource access is tiered. So on the left-hand side, we've got the 5 main All of Us data types: survey, EHR, physical measurements, genomics, and Fitbit. Next slide. And the access to these 5 data types can be broadly divided into 2 components. So the unlocked component and the locked component. Next slide. And so for the unlocked component, that is our public tier. So that consists of the summary statistics and aggregate counts. And that data can be explored using our data browser. And this is publicly available to anyone. You do not need to register as a researcher. Next slide. Now for the locked component, we have 2 tiers, the register tier and the control tier. So the register tier, you'll have access to surveys, EHRs, physical measurements, and Fitbit. Now for control tier, you'll have access to those 4 data types in addition to genomics data. And both the control tier and the register tier require a registration, and you can access them using the Researcher Workbench, which I'll dive into a little bit more detail in a few slides. Next slide. And we hope that from future ancillary studies that we'll be able to provide individual biospecimen and participant level data in the future. Next slide. Great, so now let's take a deeper dive into the Researcher Workbench. Next slide. Perfect. So the Researcher Workbench is a cloud-based platform with a suite of tools to support data analysis and collaboration. And so the Researcher Workbench can be divided into 4 main components. The first component is workspace. So a workspace is where researchers can access and store data and also collaborate with other researchers. And so we can think of a workspace as a file cabinet where you store everything you need about a project. And you can also share that file cabinet with a collaborator or colleague in which they can, read what's inside the workspace and also make changes to it. So inside a workspace are notebooks, and these are Jupyter notebooks that perform high power queries and analyses. And currently we offer Python as well as R notebooks. And the last two components on the bottom of the slide are the cohort builder and the dataset builder. So these are custom point and click tools that are very easy to use for helping you create cohorts of interest and also build collections of health information about those cohorts. Next slide. And so here, this is a 5-step approach to conducting research on the workbench. So step 1 is to create a workspace. Once that's done, in step 2, you will use the point and click tools like the cohort builder and the dataset builder to create your cohort of interest and build a dataset. Then you will export that dataset to your notebook in step 3 and then analyze it using the Jupyter notebook. So as I mentioned, we currently have Python R, but the DRC and the program are currently working on expanding access to different types of statistical software and other computing software in the future. In step 4, you will evaluate your results, test your hypothesis, draft your manuscript, and then step 5, disseminate your findings with a broader community. Next slide, please. Great. So now let me show you how you can actually use the Researcher Workbench and how to get started. Next slide. Okay, so the first step is registration. Remember, if you want to access the control tier and the registered tier data, you have to be a registered researcher. So you can scan the QR code or feel free to navigate to researchallofus.org. And if you click on the top right, that bright orange button, register, will take you to the registration page. So registration is very straightforward. There's 6 steps. The first step is to learn more about the data set available using the data browser. And step 2 is to check if the institution has an agreement with the program. And I think Morehouse has that institutional agreement, so we're good to go. Step 3 is to create the Researcher Workbench account. Step 4, verify your identity. Step 5, complete all of us research training. And then step 6, sign the data user code of conduct. And then you're good to go. So next slide. So after registering, you can go ahead and click Researcher Login on the top right of the page. It will take you to this landing page to the right where you'll be asked to log into your account. Next slide. Once you're logged in, step 1 is to create a workspace for your project. And here on the slide, you can see that I've got 3 panels here, and these correspond to the 3 different workspaces that I already have. But to create a new one, I'm going to click on that little plus button as indicated by the orange arrow to create a new workspace. Next slide. Thank you. To create a new workspace. And the first thing that you'll do is name your workspace and then select your data access tier between register versus control. Remember, the difference is that for control tier, you'll have access to everything that you have access to in the register plus genomics data. Next slide. And the next step is to, next slide, please. Thank you. And so the next slide, the next part is to choose your billing account. And I would like to mention that the program provides $300 in initial credits to help you jumpstart your project. Next slide. And the last step is to provide a project level description, and this will be publicly displayed in our projects directory. Next slide. All right, so that wasn't too bad. So that was creating your workspace. The next step is to build your cohort. So to do that, you can click on the upper left, that data tab. Next slide. And this will take you to our point and click cohort builder tool, in which you will specify the inclusion and exclusion criteria for defining your population of interest for testing your hypothesis. And so here on the right, you can see that you can add a criterion and you can search for specific criteria that you're interested in by typing free text or using a drop-down menu, and you can include information about the demographics, survey responses, specific medical conditions or drugs or genomics information. Next slide. Once that cohort is created, you will go to the data set builder. And this is where you can add information to your cohort and then build a data set about that cohort of interest. And so here you can add information about demographics and surveys, Fitbit, et cetera, et cetera. Next slide. And once you build that data set, you can click on the analysis tab. Next slide. And this will take you to the Jupyter notebook. So this is an example screenshot of a Python notebook where you can analyze, visualize, and test your hypotheses. Next slide. Great. So that was a really quick overview of how to use the Researcher Workbench. But one thing I really want to direct everyone's attention to is the User Support Hub. So the User Support Hub is basically a really great treasure trove of very helpful resources and articles and videos on how to work with the All of Us data and also how to get started with the Researcher Workbench. Next slide. One resource that I would really like to highlight are the featured workspaces. So to navigate to the featured workspaces, you can go to the top left drop-down menu and click on Feature Workspaces. So feature workspaces consist of tutorials and demonstration projects on how to work with each of the 5 main data types in the All of Us Researcher Workbench. And when I was starting out as a new researcher on the Workbench, I found that these were really, really helpful because I can see the code, I can duplicate the Workbench and then modify the code for my own research project. And this was a really great time and money saver. Next slide. And we also offer a wide range of support tools based on your preference. So if you have any questions at any time, please feel free to email the Data Research Center at support@researchallofus.org, or please feel free to join one of our drop-in new user orientations or weekly office hours. And like I mentioned before, the User Support Hub is a great place to get started with your research project. So my last thought is that for this presentation, I really gave everyone a snapshot of how to get started with All of Us data and the Researcher Workbench. But not every research project is the same. And you will find that as you're working on your research project, that you may run into very unique questions for your research. And in those cases, I would really highly recommend that you please reach out to the support team at research@allofus.org. Email us with your questions. We promise that we will be here every step of the way to support you, and that we're always committed to answering your questions and to ensure that you have exactly what you need to be successful with your research project. So with that, I would just like to thank everyone for listening. And we also have a Q&A session in just a little bit, so I'll be happy to take any questions that you may have. Thank you.
Okay, good morning, everyone. I'm Robert Meller. I'm a professor of neurobiology at Morehouse School of Medicine. I had the opportunity for a pilot project using the Research Workbench. And so today what we're going to do is we're going to actually go through some of our experiences of using the Workbench, just in slightly more realistic terms, in terms of a researcher who may not be a computer scientist or coding specialist. Next slide, please. There we go, great. Okay, so basically we're going to just go through again the concept of the Researcher Workbench and really how we use the Research Workbench to generate a data set that enabled us to do an investigation on the effects of hypertension and diabetes on dementia prevalence in the patients or participants who are part of the Researcher Workbench. Next slide, please. So again, just to remind everybody, the Researcher Workbench is hosted and housed in the cloud. So this means, number one, you do need a good internet connection. Second, you need a little bit of experience with using the Jupyter Workbench for running R and Python coding. And third, one of the most important things that we learned is do not, on any circumstances, attempt to download any of the data that is in the Researcher Workbench. That is a big no-no and will result in immediate cessation of Workbench privileges. Next slide, please. Okay, so again, we were using the Researcher Workbench to develop a patient cohort. So in our project, what we did is we had to come up with learning how to use the cohort builder to correctly identify those participants who were an appropriate research group to look at dementia. So for our project, we then would select in patients or participants who were age 50 and above, 50 to 80, because that's the sort of age groups that we'd be able to actually see dementia in. The second thing we had to do is make sure that we had participants who had electronic health data. If there's no electronic health data, we don't know whether or not they've got dementia or other conditions. So you have to go through a few phases of filtering down the cohort before you're actually going to be able to generate the cohort for your analysis. This requires collaboration both with physicians and clinical scientists, as well as with your other computer scientists, for developing these codes and determining what's an appropriate filter, what's an appropriate participant data set going to look like. Next slide, please. So this is an example here of when we're actually using the workbench to filter down. We were looking at a certain age group of population. We were looking for participants who had sex and health data associated with them. Unfortunately, there are some participants who don't. So you cannot use everybody. You have to apply these filters. And finally, we wanted to make sure that people had appropriate data regarding sex and race and ethnicity, because we also wanted to ask the question whether there was an impact of race and ethnicity in the data. Again, one of the challenges we had was not everybody reports in a NIH-approved way what their race and ethnicity is. Some people prefer not to answer that question. Some people put in multiple race and ethnicity characteristics. So what we actually had to do is actually develop a quick way of conglomerating those two categories into a self-identified race and ethnicity data set within our cohort. Next slide, please. Now, one of the more interesting concepts to me as a non-clinician is how many terms physicians these days have for high blood pressure or hypertension. There was something like 30-odd terms for this. So one of the learning experiences we had is learning how many different ways a doctor can say you've got something wrong with you. But unfortunately, this actually then means that when you're going through the concepts, you have to really slowly go through the medical dictionary and actually identify all the concept terms associated with your disease. Diabetes, type 2 diabetes as well, actually has a lot of concepts as well. And included in that are certain adverse complications as well. So you basically end up having to glob all of these conditions together and then refining them down into a consensus diagnosis. And then quite frankly, if say a patient has hypertension or high blood pressure, you just need to accept the first instance of it, find that patient has high blood pressure. Next slide, please. Okay, so once we've selected these cohorts, you can then start trying to assemble your data set. So then what we have here is a screenshot of what the actual data looks like. We've very carefully removed, by the judicious use of large blue boxes, all the participant information to de-identify and make sure no one can see whom we're talking about. But what this gives us an idea is the different terms that people are using for things like hypertension. So we've got benign hypertension, hypertensive disorder, essential hypertension. So again, all of these terms have to be brought down into a single usable term. Next slide, please. And one of the other challenges that we'll have is that you'll have multiple visits to a doctor. And each time you go to the doctor and you've got a high blood pressure measurement, it will be recorded as having hypertension. So again, we then just really need to reduce down. You've got hypertension once, you have hypertension. So this is what a simple analysis project looks like. And I'm using the term simple very, very broadly. So you can see from all the participants who were in the database, there were at the time 223,000. We then refined it down to those participants aged 40 to 80, which dropped it by about 70,000. And then we had to make sure that those participants had electronic health records and sex at birth. We then created a separate set of cohort data sets for the different medical terms we were interested in: consensus hypertension, diabetes, and dementia. Then once we have all those data elements, we then have to use the Researcher Workbench and use R programming to be able to join these data sets together to end up with a final data set that allows us to then perform a statistical analysis. Now, I'm going to be honest with you here. Using R and/or Python in the Jupyter Workbench is a quite steep learning experience. With due respect, if you want to learn to fly a plane, you can't just jump into an aeroplane and boom, off you go. You're going to have to learn a few background rules on how a plane works, how the instruments work, etc., etc. And quite frankly, using programming for this level of analysis is a little bit of a learning experience. So you have to be able to learn how to use the programming language to be able to perform these analyses. And this is one of the big challenges that we've seen with the Researcher Workbench. It's just getting over that initial hurdle of learning R or Python coding to be able to use this powerful tool. Once you put the time investment into learn those basics though of coding, the payback is huge. You can use this workbench to do a lot of analysis. So it's really a cost benefit type analysis. Next slide, please. So again, this is an example of what the workbook looks like. Next slide, please. And so again, we were using R coding to create self-identified race and ethnicity categories. And so this again requires R coding to be able to extract those elements from one data column and then write a new data column. And so a lot of data analysis and big data and analytics really is data wrangling. That is taking the initial forms of data that you get from, say, the workbench or any study, quite frankly, and then actually manipulating those data sets such that the columns are in the right order and they contain what you actually need to be able to perform your analysis and then draw your pretty graphs afterwards. Next slide, please. Okay, so this is an example of one of the challenges of using R, though. We can see the simple looking bar chart on the right-hand side of the slide. Well, that is generated by about nearly 10 lines of code. This, again, is one of the slight challenges of using R and Python for generating analysis and generating graphics, is sometimes the code is not initially very intuitive. And so there's a very large barrier there into using these tools because you have to learn the syntax. You have to learn how to set up your data so you can call a graph on it. And that, again, is one of the big challenges that we have. Next slide, please. Okay, I think my co-presenter is going to take over from here, and they're going to talk about how you actually plan the costing of a project and then some of the more advanced features when you're looking at genomics.
Dr. Javon Carter. I am a bioinformatics scientist here at RTI, and I'm also the head Researcher Workbench Researcher Academy coach. And I am here to talk a little bit about some of the ins and outs. Oh, can we go back to the previous slide? Talks a little bit about the ins and outs of the costs and also different aspects you can do within the genomic analyses on the Researcher Workbench. So like what was mentioned before, you do have a $300 credit that you can initially use, and everybody can get it within the Workbench. But as most people typically end up asking me, and or how I've experienced myself, the cost does range as far as how much you can actually, or excuse me, how far an analysis can go with $300. How short it might go depending on what's going on, especially when you're looking at a general statistical analysis ranging to a pretty complex genomic analysis. So as you can see here on the slide, you have the standard cost, which will be about 20 cents per hour if you're actually running analysis, or it's going to be maybe about 1 cent per hour if you're idle, and it's going to be about $4 per month if you're going to be just storing information. When I say storing information, I mean it kind of ranges, but more or less something small to large will be about $4 a month. What you're looking at here is also the breakdown of the configuration of the instance that you will get initially. So the default is 14 CPUs and 15 gigs of RAM. If you don't know what that means, we can break that down definitely in the Q&A, but for maybe some more tech savvy individuals, 14 CPUs, one CPU can more or less do one job. several CPUs can do multiple different jobs. More or less, you would only normally need one or maybe two CPUs at the very most to do any kind of statistical analysis, again, broad to general terms. So if you look at it, you're thinking to yourself, 20 cents an hour, that's not that bad. I mean, if that's the case, then that $300 should be able to run the entire course of my research project and then some. But in actuality, more times than not, I realize that it's not necessarily the running cost. It's honestly the storage cost that adds up over time. So for instance, one example that I have is that I ran an analysis. I pulled out about 100 gigs worth of information, and I've been analyzing it, and I was storing it. And every month, I think I'm charged about $30 or $20 to $30 every month to store it, because there's so much information that you need to store. So keep that in mind. And the second part, you can see that the CPU, if you increase the CPUs, you increase the RAM to 32 or to 208 gigs of RAM, it is going to increase the computational cost as far as running and idle. Well, mostly running, but not the storage. The storage is the same because you're still storing the same information, but the instance, because again, this is a server, this is a cloud server, the instance that is required to do that analysis is going to be bigger, which means it's going to cost more money. And then last but not least, if you are planning on doing a very large scale complex analysis and you want to use the cluster, which we have done that in the past, you want to use the cluster feature where you're using multiple nodes to run various different analyses at the same time. So you're you're running things in parallel with each other. You can see that the cost to run it goes up substantially, and that is per hour for more or less all the nodes to run at the same time. That does add up, especially if your analysis that you're running is going to require several hours to go through. Next slide, please. So for most genomic analyses, I'm a genomicist by training. Most genomic analyses, it takes hours for analysis to run, which means it takes a lot of money. For one particular analysis, we ran the cluster and we end up getting a bill of $700 just because of how much data we're running. And granted, we did end up developing like, I think maybe 300-400 gigs worth of data from it. So it was very beneficial, but you can see how the cost goes up versus I ran a complex analysis looking at doing a GWAS recently over the summer, and that was $20. So, and that was an extensive GWAS looking at one chromosome in that instance, but it was extensive. There were definitely thousands of samples within that analysis, but you can see how the range kind of varies. Within the genomic analysis aspects, if you are going to be doing anything genomics, you have to use Python, the Python kernel on the Jupyter Notebook. Unfortunately, not everybody can code in Python, so that was a little bit of a hurdle over the summer. If you're going to be using any of the genomic software that is presented to you, so some of the packages, you have Plink and Hail. Plink 1 actually, because it's Plink 1.9. So just keep that in mind. It's not technically Plink 2, but Plink and Hail. Plink is a really great resource when it comes down to understanding and utilizing pre-rendered functions and software to run set analysis. And same thing goes for Hail. But unfortunately, if you are going to be using Plink or Hail, you also need to understand the bash syntax. So that's another layer to it. So you need to understand Python and have a general understanding of bash as well. And then on top of that, if you are going to do a genomic analysis, you should probably have a good idea of what kind of format you're going to need to do your research in. Do you need a CRAM file? Do you need a BAM file? Do you need a VCF table? Do you need any kind of the Plink formats or a BED file or a GTF file or a BIN file, FAM file, etc.? You can see that it adds up. So you need to have a pretty good understanding as to where you need to go, or at least what you need to have and where you need to go in order to have a more or less seamless transition from one task to the next within the platform, because it does get a little technical. And while you're going through these files, you also have to keep in mind the size of the file, because the size of the file would 100% be associated with the cost that you end up accruing in the grand scheme of things. And that's also associated with the storage, which again, it all kind of plays a factor. So you need to be pretty on top of your game when it comes down to setting up your analysis plan and what you're expecting to use, because that is going to help you understand exactly what you can really do within the platform with the $300, or even what you're going to need above and beyond. But I will say that one of the amazing things that after doing several genomic analyses, one of the amazing things about the platform is, number one, they actually already predict ancestry, and they already calculate ancestry within the workbench, which is a key feature, a key vital feature that is required for a lot of genomic analyses nowadays in order to combat any kind of confoundment effects on a population level. So that's helpful. They use that. They basically calculate that using a PCA, so principal component analysis, which is still one of the standard methods. And on top of that, they also give you a lot of different types of annotations within the genomic information. So the short read and the long read, definitely from what I've experienced, I have not looked into any of the structural variant files yet. So if you have any questions on that, I will gladly look into it for you, but that's as far as I got for that. Next slide, please. And then the very last thing I was going to say, sorry about that. I was like, I know I'm talking too much. I'm sorry. I'm almost done. But the very last slide I was going to say, which was actually mentioned before, some of these are actual genomic analyses and a walkthrough of what you can and can't do within, what you can do and how you do it within genomic analysis. And these have been very, very helpful for my team and for other researchers that I worked with as far as doing genomics, because it shows you where you should go, how you should label your samples, how you should label your variants, things of that nature, all the annotations you have. So that has been very helpful. And I do think that moving forward, that will be a key feature for more scientists to use to at least get an idea of what the roadmap is supposed to look like. Next slide. So in conclusion, the workbench is amazing. It's amazing. It's incredible. It has a lot of resources. You do have to have a pretty extensive breakdown of medical terminology, data, dictionary concepts, advanced scripting capabilities, unfortunately. But at the same time, when it comes down to the vastness of the information on the platform, if you can get over that large learning curve, yes, this is a great tool to have. But it is one of those things where I do recommend people put in that time to get the experience in for a few months before you really start diving in and exploring it. Thank you.
All right. I'm not quite sure if I should be looking at the camera or at everyone here, but camera. Okay, awesome. Awesome. Well, thank you so much for the opportunity to present some of my work. And what I wanted to do in this presentation was to tell you a little bit about myself, some of my work with All of Us Researcher Workbench, particularly around the Institutional Champion Award, which I'll be talking about towards the end. But in terms of kind of a high-level agenda, I'll start off by kind of talking about, like I said, some of my research and some of the assets within All of Us related to digital health, specifically in the Fitbit data, and then tying that to some of the current projects that I'm working on. And then, like I said, ending off with some discussion on the community of practice, as well as the All of Us Institutional Champion Award. But by quick background, my name is Mohammed Idris. I'm an assistant professor in the Department of Medicine, also an associate director leading digital transformation within the Clinical Research Center, and then also one of the founding co-directors for a new Center for Digital Health, which is funded by the Novartis Beacon of Hope Initiative. Oh, next slide. Yeah, awesome. So a lot of my research really combines data science and machine learning with community-based participatory research to design more accessible behavioral interventional technologies. And so you could imagine that there are a variety of different chronic diseases, and self-management, of course, is a big aspect of dealing with those. And so specifically, my research focuses on the role that technology can play in providing a more scalable solution to support self-management. And this is a lot of work that Dr. Puma and I have been working on within the context of underserved communities, specifically focusing on poor Black adults with poor cardiovascular health. We've done some work in diabetes self-management as well. But the basic idea is that technology could sort of serve as an adjunct in helping scale some of the personalization that often is required for some of these more self-management type interventions. And here, what you have is a sort of time series for one of the projects that we worked on, where we see that kind of the use of these digital health tools for collecting data, for example, on sleep or heart rate variability or general activity definitely varies over time. And when we think about folks leveraging more commercial type kind of health information technologies as far as managing their health or within the context of more clinical interventions, the reality is that folks tend to oscillate from being active users or not active users. And so there's kind of an underlying data generating process, usage, thinking about active usage that I think is something that is important to think about, particularly as we're thinking about kind of dose response with respect to digital health interventions. So the idea being that per a particular type of intervention, a particular type of outcome, and the particular digital health intervention or the tool that's actually developed, there are a variety of things that I should be thinking about. And fundamental to that is how much should I be using this particular tool in order to reach some sort of effective outcome? Next slide. And a lot of my research really focuses on this idea of distinguishing between identifying kind of active, engaged users, and particularly kind of clinically meaningful use. And so this is a slide that I often put up in some of my presentations where we're looking at two different individuals using the same wearable device tracking activity, but across two different interventions. And the question that I often ask is, which of the following is the more active or engaged user? We can see that in A, we see quite a bit of active usage early on in the time period, a little bit of a drop off. The user then comes back and then it tails off. And then for option B, we see again over that same time period, we see again spurts of activity. And it actually turns out that actually there is more meaningful activity in terms of relating that to an outcome in participant B than participant A. And the challenge that we find in this sort of research is that unfortunately we don't have as much data when it comes to underrepresented communities. And so thinking about the resource that is the All of Us Researcher Workbench, and a part of it, which I think is often kind of underutilized or not really spoken about, is the Fitbit data on there as well. So next slide. So here I put together just some citations around the use of digital health technologies in underserved communities. The first two citations highly encourage everyone who's interested in this space and interested in leveraging the All of Us Researcher Workbench for digital health research to check them out. The first citation is looking at kind of barriers to the use of digital health devices within the context of federally qualified health centers. And so in this paper, what the authors did was essentially created a survey instrument to characterize what are some of the barriers to usage and opportunities to leverage some of these digital health technologies within the setting. And some interesting findings there. And then the second paper here, which I thought was really interesting, is really associating step counts over long periods of time with the risk of different chronic diseases. And in particular, they looked at things like obesity and diabetes, in particular around self-management. And then I've included two citations here from my work that's not specific to the All of Us Researcher Workbench, but really does motivate some of the work that I'm thinking about, some of my current projects on that workbench. The first one being around accounting for or controlling for a usage within the context of a technology-based intervention. And so when we're doing analyses, and I'll talk about this in a second, that is associating activity or data collected from a wearable device on some sort of health outcome, the actual usage of that device is something that we found is important to control for as far as outcomes are concerned. And then finally, thinking about, again, users oscillating from being active to inactive users and how to actually model that. And there is kind of this underlying principle, a sort of law of attrition within the use of digital health tools, where, again, the idea is that we're often oscillating between wearing our wearable devices and not, right? Very often we don't see kind of consistent usage over time, which we'll see which we do see in the All of Us Researcher Workbench as well. So some citations that I wanted to share as well before moving on. So next slide. And thinking about the wearable data within All of Us, there is quite a bit of data in the All of Us Workbench. Definitely not as much as, for example, the social determinants of health data that was presented in an earlier presentation, but we have upwards of 15 to 16,000 participants who over time have collected quite a bit of wearable data. And some of this data is on heart rate variability, some of it is on activity, step count, and the rest of it is on sleep, looking both at more smaller epochs, so kind of 1 minute intervals, as well as kind of larger epochs, I think at the day level. And some of my current projects that are looking to leverage this data focus particularly on characterizing engagement with digital health tools across subgroups. On the previous slide, I mentioned that first citation where I think they did a great job of talking about or surveying folks to understand or characterize their kind of barriers to usage, but actually thinking about engagement across different subgroups, I think is a really interesting, fruitful opportunity for research. Secondly, association of activity with the risk of chronic disease. This was also another citation, but then also controlling for, like I said, engagement over time. Again, there is underlying data generating processes that we need to model in order to account for that. And then the third one, which I think is really interesting, given some of the work that I did in my first postdoc, is really looking at modeling circadian rhythms within wearable data, and specifically looking at it within the context of sleep data and associating that with the risk of chronic disease. Again, these are just some examples of the sorts of projects that I think we've kind of been chomping at the bits to have kind of larger, more representative data in order to analyze. So next slide. And so what I wanted to finish off is really kind of putting all of this within the context of all the things that are happening at Morehouse School of Medicine, both in terms of what we're trying to do in terms of developing a community of practice around the use of the All of Us Researcher Workbench, as well as the All of Us Institutional Champion Award. And I think it's important to put all of this into context and really start with the question of why is this work important? And I know, it's a mantra that has been said to me a bunch of times since I've joined the institution, but we really are at the forefront of training the next generation of diverse biomedical and data scientists. And I think that's really key because not only do we need representative data, but we also need representation or diversity in the investigators who are actually asking and interrogating the data, making sure they're asking the right questions. And obviously that does not end with problem formulation, right? There is this idea that in order for us to understand how to apply these techniques properly within the context of health disparities research, but as Dr. Meller and others have presented before, it's not enough to just kind of know what to do, but there are practical skills that are needed in order to leverage these resources. And so, for example, you can accomplish one task, of course, writing code, and write very efficient code that could basically use a negligible amount of your credits on the All of Us Researcher Workbench. But for those who might not have a programming background, who are trying to kind of copying and pasting code online, and often I do that myself, and not knowing really how to interrogate or write efficient code, we really can find ourselves in a position where we're not able to fully take advantage of those resources. And so in order to address some of those concerns, we have a variety of different training initiatives that, again, we're trying to build a community practice around. Part of that is going to be the All of Us Institutional Champions Award, where as part of that award, we're looking to, and we've already identified some here, 2 faculty members, 3 postdocs, and 3 trainees. And these can be undergrad all the way through kind of medical students, graduate students, who are really interested in getting trained up on the Researcher Workbench. The first thing that they would need to do is, of course, to register and take advantage of the actual onboarding onto the Researcher Workbench. We're also working very closely with our colleagues at RTI so that they take part of the academy as well. And the goal is for us to develop kind of a focal point of expertise around all of us Researcher Workbench, such that we can be a resource for the institution at large. And so for those who are interested in learning more about these opportunities, either participating in our community of practice or know folks who would be kind of great for the All of Us Institutional Champion Award, definitely reach out. I think the new thing nowadays is everyone has QR codes instead of those short bit.ly URLs where you don't know if it's a 1 or an L. So feel free. We can go ahead and share the slides as well. But basically what we're trying to do is just, again, trying to get an understanding of where the interest is within the institution, such that we can kind of collaboratively put together this community of practice and something that, again, will be a resource for hopefully trainees and other junior investigators who end up coming to Morehouse School of Medicine. And this, I think, is an excellent resource, again, to get people up and running with their research programs as far as preliminary data. And so with that, just wanted to thank you all for the opportunity to present, as well as our colleagues at RTI.
So good morning, everyone. I'm here to share a quick presentation just celebrating and recognizing the role of community in our research in the All of Us Research Program. I'm the project director for the All of Us Research Program here at Morehouse School of Medicine. Next slide, please. Oh, the slides are up. Okay, next slide. All right, so to start with, this is a little collage just showing our team. Over the years since we got started, we have had the opportunity to work with some amazing people. These are some of our current and past members, the frontline staff who do the work of getting that data from the participants that you all have access to in the Researcher Workbench. This is not an exhaustive picture, but we are very grateful to everyone for their hard work and what the commitment they put to what we do on a day-to-day basis. Next slide, please. It's also members of our team. Again, we have the opportunity to work with a lot of people across Morehouse School of Medicine, Morehouse Healthcare, Grady Hospital. You may see some of our team in the building here in the room. We appreciate everyone for everything they've done and all their commitment to handling the data, to handling the biospecimens, the survey data, and everything that our participants provide to us. Next slide, please. So just to give some background, we got started with enrollment for the All of Us Research Program back in 2018. We are currently in our 6th year. In the course of a year since we launched, we were able to bring on sites at Morehouse Healthcare, at Grady Hospital. We hit COVID just like everybody else, and we had to pause for about a year in our in-person recruitment, but we have slowly but surely come back up with that. We are currently, as of this month, on our way to 5,000 core or fully enrolled participants. And so we're really excited for the work that has gone into this and the opportunities that the community has given us to bring this to them. Next slide, please. Some of our strengths and successes have been that we are focused based off of our experience with Morehouse School of Medicine's mission and vision, with the Clinical Research Center's vision. We have been able to optimize face-to-face engagement and recruitment. We have been able to optimize our enrollment experience, use evidence-based analytics to improve our process, and also to adopt a culturally congruent approach. This last one is really important in working with the community because a lot of, as you'll see, we're going to speak to some of the challenges that we have, but a lot of people that we engage with in research actually do not have a good experience with research, and we are able to, through the efforts of our staff, through that approach, to make them understand how they can use research to help them. Next slide, please. Some of the priority UBR groups that we focus on, it's a bit small here, but hopefully you can see it, is really based off of All of Us Research Programs focus on getting the research and the ideals of the program, the core values, is to be able to include persons who identify with ancestry, race, ethnicity, which is different from the main, education, lower levels of education, older individuals who in many cases are more vulnerable to the barriers to participation in research, and they fall into several UBR groups and may not be able to participate in research. There's other priority groups such as sexual and gender minority, those with disabilities. And so we focus on these in all our outreach with the community. Next slide, please. These are some of our recruitment channels. Next slide. This is a huge list. You might recognize some of these. We didn't know the best way to present them, but we wanted to appreciate and recognize everyone who has had a part to play in the All of Us research program. Currently, we have gone to over 250 different events. We have multiple events, sometimes with different partners across the Metro Atlanta area. We have partnered with faith-based organizations, with sororities and fraternities, the Divine Nine. We have been able to do so much, and it's all due to our community partners that you can see on this slide and the next slide. Next slide, please. Next slide, please. All right, so one of the things I just wanted to highlight was a success story, or an ongoing success story with our seniors. As you may remember, I mentioned that this is one of our groups that is underrepresented in biomedical research. And they have often had bad experiences, or they don't really know that much, or they have difficulties with access. There are multiple barriers to participation, in research. And so last year we were able to bring all of us to a nearby senior center, which is the Brandon Tower Senior Center, just a few miles away from campus. We partnered with them. We were able to bring the research of all of us to them. We had a lot of interest. We had people who registered. We had people who went on to be fully enrolled or core participants. Next slide, please. And now we are expanding our outreach. Our engagement team is feverishly working to make connections with other senior centers that we will be able to bring all of us to be able to help them with understanding more about this, and so that their data can be available to researchers as well, to be able to investigate the things that that bother them, that are an issue for them, so that they can see themselves represented in what is being done, in the cures and the treatments and things that are being developed out of the data. Next slide, please. I also wanted to highlight the impact of our CRCR Clinical Research Center mobile fleet. I think it cut off a little, but that's managed by our engagement core. They have been instrumental in us being able to outreach to rural areas, to places where they just generally would not have an interest or be able to come in to participate, so we can actually take all of us to them. We were really excited to be able to launch this initiative with them in May of this year. We have an RV, we have Sprinter buses. You can see some pictures of our team working out in the community. And we're really excited to be able to take this further, be able to have pop-up clinics and mobile enrollment for all walks of life to be able to participate in All of Us research program. Next slide, please. All right, so these are some of our challenges and opportunities which we're looking to overcome. We're going to expand our sites. We want to optimize our team capacity. We need to improve our outreach to UBR communities, and we are consistently working on that, as well as piloting approaches so that our participants, their feedback is heard, and the return of value from the program can be optimized to them. Next slide. Next slide, please. All right, and this is, I think at this point, we're about half of our enrollment, of our current enrollment. This is just a Wordle, just showing some of the feedback from our participants, which has overall been very positive. Next slide, and I think that's just the final slide to wrap up and thank everybody, all our partners. They are too many to name. They are people in the room here. They are people in the community, our team at Grady. We just appreciate everybody. We appreciate the opportunity we have to participate in this program, to work and expand, to now be able to work with things like the Researchers Academy and other different organizations across the galaxy, so to say, of All of Us research program. So we're very grateful to you all. Thank you. If you are online, you might be able to see a link or a QR code in the chat. We also have a QR code, but I forgot to include it here. If you are interested in actually becoming a participant and enrolling at one of our sites, you're free to do that. I had to put that in. You're free to do that. Please feel free to speak with me or reach out to us and we will follow up with you. Thank you.
Thank you so much. So I want to just acknowledge we've been at this for a while, maybe now an hour and a half. And so we're like into the closing of this. But before we do close, we have time for Q&A. And we recognize that we have generated a lot of questions. So I'm actually going to ask Javon and Dr. Meller to come up front. It seems that a lot of the questions online were specific to you. Yes, don't be surprised, Javon. So we're going to work at curating those questions to you. Yeah. So you can use this microphone to respond to those. Or Virginia, you want to start us out with questions?
So the first question was, does anyone use SAS or SAS Python in workbench notebooks, SQL, and PySpark? Python Spark, maybe?
Okay.
SQL.
Well,
SQL.
SQL.
Okay.
And
Yeah.
then also
Python
something
Spark.
was Python Spark.
Okay.
So as of right now, SQL, yes. That is actually how you get the data from all of us into your Google Cloud bucket. So you have to run a SQL query, and then from there it will pull using the query criteria and parameters. I know that sounds technical, sorry, but that's how that works. As far as SQL goes and as far as SAS goes, no, SAS is not on the workbench yet. But if I'm not mistaken, I think there's talk about potentially introducing that as a tool in the future, but don't hold me to it. I'm not 100% sure. But as of right now, no SAS. And then the last one, which is Python Spark, I'm not entirely sure, but I can look up that information and get back to you. So.
Next question.
Please come up.
Yes, we have one in the audience.
A real life question.
Hello, my name is Dr. Deanna Lewis, Morehouse School of Medicine, Department of Community Health and Preventive Medicine. I just had a question. Are you able to install other statistical software other than what's in the R packages in Python?
No, so R itself has a lot of statistical analysis tools, but all of the analysis will have to be done either through Python or R at this time. But the array of tools that's available for those two platforms is quite amazing. And there's pretty much nothing you can't do with one or the other, quite frankly, in terms of everything from a straightforward t-test to a multivariable AI model-based mixed media model. So, I mean, you've got a lot of options available with both packages.
I also want to recognize Dr. Shear is also online. So would you have any additional comments, Dr. Shear?
Yeah, I definitely echo Dr. Carter and Dr. Miller with their answers. I also want to add a point about SAS. So currently the Data Research Center in the program, we are working with, we're partnering with public health scientists and researchers to actually bring SAS into the workbench. So we are actively working on that. It will be forthcoming, so please stay tuned. Yeah.
All right, thank you. Another question in line.
Yes, thank you so much for this wonderful information. My name is Jamie Hopkins. I'm an assistant professor in the Department of Community Health and Preventive Medicine. During your presentation in particular, you spoke to the learning curve when it comes to the analysis portion utilizing Python and R. Recommendations on resources or maybe even structured trainings to kind of help with facilitating that learning curve would be really helpful.
Certainly. So at Morehouse School of Medicine, we have an Introduction to Data Science 101 course, which is a one-week R workshop, which is available for all students, faculty, postdocs, etc. That's run every year in May. We also have a genomics and data science learning community, which once you've picked up some basic skills in R, this is an opportunity to keep using those skills so it keeps your brain engaged with using that programming language. They're held once every 2 weeks on a Wednesday lunchtime. So look out for the advertising flyers for that. Now, I believe that there's more formalized training opportunities as well. I'm going to let you answer that one.
Thanks. Yeah, at RTI, we have our Researcher Academy, and within the Research Academy, we offer intro to R and data wrangling courses, which are essential more or less because data wrangling is sometimes 50% of what you have to do before. Yeah, more 80%, I can see that. And then we also have a intro to Python course. We have a computational biology experts who are at RTI that we also work with the University of North Carolina, Chapel Hill, I believe, because I think they have a program, ODM, and we work with them on helping out with statistical methods and statistical analyses. So, and of course, on top of that, we have a lot of researchers at RTI who actively work on the Researcher Workbench that I also collaborate with. So, and I also distribute information to the coaching staff, and the coaching staff are all experts in their own fields, from statistical biologists to epidemiologists to public health researchers. So it just spans.
One final part to that question. Also remember that at Morehouse School of Medicine, we do have a bioinformatics unit that's part of the CRC. And so when you're planning your experiment or planning your analysis, they're an invaluable resource to go talk to before you get started to help you plan the analysis and make sure that your analysis will be appropriate for that data set as well. So there's resources within the school before you get started, when you get started, and then afterwards as well. I also would just remind you the school champion as well is also a great resource if you're getting started and need guidance on moving forwards. But and myself, I'm also involved with the Researcher Workbench as well.
Okay. Thank you.
Are there other questions? Yes. Okay. Dr. Thompson, tell us if you are.
Winston Thompson, the chair of Department of Physiology. Just a quick question, Dr. Miller. For the community engagement component, do you have a quick sheet that you could share with the community as it relates to some of the acronyms that you're using? Because sometimes that may get confusing to those individuals that are not part of the understand the research experiences, because some of the acronyms that you guys have been using today, even myself at times have to really think, like, what is a CPU, right? For example, right? And somebody in the community may not understand what a CPU is. And so do you have a quick sheet that can define as you engage the community so they understand the language that you're using? And that would also make them want to be engaged and not seem foreign to the science that you're presenting.
I'm sure something could be organized.
Oh, yeah. I know we don't, at least at RTI, don't have a breakdown yet, but that is something that could definitely be put together and get introduced and to everybody relatively quickly. So, and that is something that I've been actively working with other faculty members and postdocs with, as to like, how do you understand what compute node is, what a server actually is. I had a conversation with somebody, like, I have no clue where and what all of this is. I know it's somewhere, I just don't know where it is. I thought they said something about cloud, and that's all I got. And I was like, well, let me break it all down to you. And we sat down for 45 minutes. I explained from top to bottom exactly what's going on, how cloud works, how basically Wi-Fi is your best friend, and all that jazz. And that is something where I completely agree with you. That is an important factor that people should hopefully have easy, accessible, digestible information and access to. So.
Do we have any other questions in the room? If not, any online? Oh, one more.
Well, I guess it's okay. Herman Taylor, director of the Cardiovascular Research Institute here, formerly of the Jackson Heart Study. People like to know that. But my question today, my comment today, is that as one of the PIs of Aim Ahead, I'm really looking forward to how we can how we can grow closer. I mean, Aim Ahead, as you know, is all about a lot of the principles that Dr. Idris articulated in terms of health equity and artificial intelligence. And this interface, this convergence of AI, health equity issues, the notion that we need more diversity, not just in the databases, but also in the people who are doing the data analysis. We have a lot of common ground. So I really do look forward to working more closely with you guys and campus community partnerships as appropriate. So thank you for the presentation. Thank you for your presence here today.
Thank you.
So I have a question actually for Dr. Pimu. So we'd like for you to come up front. Yeah. So, I mean, maybe, and I was hoping that Dr. Idris would still be here, but I wonder, like, we talked a lot about like our own work. What's the big picture? I mean, as researchers who have a commitment to equity and justice, I'd love for each of you to kind of comment on how you see us moving forward with this work beyond the direct recruitment, but what's the big picture for you? You know, we talked about community practice. We talked about a lot of things.
So I don't know that it's going to be a different thing than what I shared already. I think more it's an elaboration. I think that the big picture is recognizing that each of us has a particular slice. Each of us has a particular view of the world, a particular set of skills. I think that our community is best served when that can come together to ask the questions that matter, to generate the responses that actually advance health equity for our community, for our children, for our grandchildren, for everyone that's coming behind us. And so in my mind, we were very excited to have this conversation because it is fulfilling something that we committed to from the beginning. So it's not just that we are getting our community to contribute data, doing the excellent work to make sure that that data is unassailable, but also making sure that our researchers, our trainees can use that data to ask and answer the questions that they do. I can't tell you how different it is when I sit and I listen to the kinds of questions that concern our students, our faculty, our staff, the questions they ask. It's the real questions. And so giving them the tools to be able to use this, to my mind, the excitement about this data, it has its shortcomings, but the excitement in this data is the fact that it democratizes our access to data that's this broad and this deep, right? And so you can, you don't have to have the gajillions of dollars it takes to create this repository, to curate this repository, and to keep it going. So to my mind, that's democratizing it. Now let's know how to, so that we can actually take advantage of it. Like I said, there are opinions about certain shortcomings that it has, but there are things we can do as well. And I would really like for that to happen. I want the thought behind the community of practice is that you don't get discouraged because you're working alone and you run into a challenge and you don't know how to go forward, or it just feels like it's such a high hill to climb, that you're able to work with a group and develop the skills that you need to answer your particular interest and question, but move things ahead in terms of the health of our community. I spoke a lot, but thank you.
Thank you. Thank you. Dr. Mellor?
So as a researcher, I'm excited for the use of the All of Us program in general, because they've changed the way that they've designed the research study. They're trying to make it more diverse. They're trying to make a more diverse use of the data and a more diverse population. I think of it like this. If I do my research just on apples, and then I try applying it to oranges, I'm going to get odd results. Whereas if I think of it as fruit, and I have all the fruits there, I can then start properly applying an inference from one fruit to another, because I'll then have all the fruit available to model and figure out what's going on. And I consider that with human beings as well. We need to have a diverse data set of all the population. And when I say all the population, I mean race, ethnicity, gender, rural, urban, north, south, east, west. When we learn about what's available in the United States, we'll learn lessons that will enable us then to also apply this data globally as well, because the United States is such a melting pot of different nationalities. And so we actually have an ability to set up the standard for a data set here that actually could even be taken globally as well. Now, when we actually really start talking about true health justice, equity, and lack of disparities, we can really then start tackling diseases throughout the world when we have sufficient data, the right sort of data, and the data that applies to the people who actually are suffering from these disparities. So I like the idea of the All of Us Workbench. I like the idea of the All of Us program. It ties in with other large genomic data sets and health associated data sets that the world's putting together. But now what we really need to see is start really expanding it to all of the globe, so we can then start tackling health equity issues globally.
Well, Javon, they said all the good words. They said all the good phrases. But all right, one thing I would add, which I think is a beautiful thing. So this summer, like Sula was saying, we had an internship, and we had a lot of students from Howard University come over, and then there was actually a few other interns from different institutions as well. They all came through, and they were all using the Researcher Workbench. But the thing that I found fascinating was the questions that they were asking, because they weren't asking questions like, well, I want to figure out this obscure or very rare disease. I want to figure out this thing over here. They were all asking questions about their community or their population, their people, and they want to kind of get down to the business of what's going on. And they're asking questions that senior scientists are still trying to figure out, that we didn't have the same resources or information to actually answer these questions yet. And they wanted to address those things. And I would say that it was a beautiful feeling when I was able to say, that information is actually in this data set. It's actually here. It's not one of the things, well, we could access it, but it's gonna be about $4,000 each of y'all, or we could do it, but we only make up about 2% of the data set, unfortunately. No, this is one of the world's biggest, most diverse data sets, and we can actually answer some of these questions. And the research that they did was phenomenal. Like, they're doing regressions, and there's some crazy some statistics I never even heard of. There are other mentors working with them, but I look at that experience that was happening over the summer as a hopeful view of the future and what we can do with this information. Yes, like we were saying, and yes, I'm gonna keep preaching this. There's a few little shortcomings because I like to be transparent about things, but the information is there and the resources are there, and there are people who are here willing to help out and contribute to make sure everybody can feel comfortable using it. But I do think that, again, moving forward, this is a good step, a good large step in the right direction for us to answer questions for more than one or two particular populations. We can actually get down to nitty gritty.
Our final question.
This is wonderful. And I just wanted to, if Dr. Miller could, and others could address this in terms of disseminating this information to the community at large that really needs to hear this information. How are you doing that? I mean, previously we have heard people have used examples of barbershops, churches, what have you. What sort of platform are you using to disseminate this information so it's not just an academic exercise that it just stays in the four walls of academia, but it's the community embrace it, and so that you have greater participation, and it's something that they're constantly seeing and hearing, such as Instagram and all of those sort of things, tools that you can use.
So the All of Us program itself does have a community engagement portion to it. And this is used not just for recruitment, but also for dissemination of information. So for example, I've spoken at HBCU events where we were talking about the use of the workbench, the possibilities of the workbench, and then some of our findings. The All of Us program as well has its own Instagram Twitter, Facebook, and email accounts. They do regular information blasts where they're sending it. Once people sign up, people then can receive these emails of the findings of the research community and then sending that information back to the general public as well. So people can see where their samples have helped research be performed as well. So the exact specific details of the community engagement is not actually my area of expertise. I believe Dr. Ife would actually know more about the areas of community engagement, but there is a large proportion of the program, of the All of Us program, devoted to communicating with the community, both for recruitment as well as for dissemination purposes as well. Also, I should state that all participants in the All of Us program as well do also get their data returned to them. So they get genomic data results returned. So that's ancestry information, some common SNP information, some fun variants, as well as now they're starting to return medical and actionable items as well. So you're not just a passive participant, there's an active engagement of participants in this program, and they receive this information back that might actually help them with making healthcare choices as well. So this is deemed not to be just a static one-way street of information. This is meant to be a community engagement, a two-way reciprocal arrangement as well.
Thank you so very much. We appreciate that. Let's give all of our panelists a hand. So we're at the top of the hour and we want to say thank you for joining us. We have a few announcements. We'll be providing follow-up information to you regarding the Researcher Workbench. It's been a highly engaging and interactive experience. We will keep you informed. We encourage you to take advantage of the Academy newsletter that will be shared with you. We will also provide you with information regarding our next road tour site. Want to acknowledge that RTI is working with Aim Ahead to help researchers as well. So there are other announcements, but we'll make sure that we share those with you. Again, thank you for coming today. We're at the top of the hour. We appreciate that. For those of you who are joining us in person, we will be actually before lunch, we will actually go down the hall and take a picture at our recruitment site. And then we will return to this room for lunch. Again, thank you for joining us today. And we appreciate you. Thank you.